Good morning, friends. Myself, Dr. Atul. I'm your faculty for injury rehabilitation and prevention. So, till now, we have discussed about the types of injuries, that is, acute and chronic. Acute overuse injuries. Acute single episode is required for that injury, and overuse uh, multiple episodes or multiple exposure after doing some activity for quite a long time, then these injuries appears. So we have discussed acute injuries and overuse injuries, how we can prevent these injuries. Now we are going to discuss about the modifiable factors. There's some the factors modifying the load applied to the bone, and the other factors which are influencing the ability of bone to resist load without damage accumulation. So what are these factors are energy availability, calcium and vitamin D, and training history. So energy availability. If a person is well fed and well hydrated, the chances of bone injury is quite less. The injury is quite common in the persons who are not well. The energy deficit is there. That energy deficit affects the remodeling part of the bones, and it will lead into injury. And as vitamin D is an important calcium and vitamin D is an important part of the remodeling of bone, or if a person who is deficit in both these things, both these calcium and vitamin, so he is prone for the stress reactions. And the training history, a person who is having a past history of training, his habit of doing exercise, or habit of playing sports, or habit of running a little bit, or then the chances of injury of overuse will be less, or chances of injury, the bone damage will be less. That his bone is well acclimatized to absorb that stress, and remodeling can be restart again and again. Cancel that restart. So training prevents that. Training prepare body for the damage and remodeling of the body. So how we diagnose these injuries? First and foremost, by the history. When we take history of our athlete, they always say, or they just say ki I have just started, or I have just increased my training load, or after a long break I have just started and I have doing this much of training, which he not supposed to do and at that much of intensity. So then this is the topmost criteria. Then comes the localized pain when we palpate on the that bony part, or it gives a clear-cut guidance. And the third part is when he narrates his history. The time he says ki when he start doing some activity, that time pain increases, and after some time that pain again reduces or wean off. And so it is typical to the stress injuries. But in the chronic compartment syndrome, as he start doing exercise, the pain increases and he has to stop that exercise in between. And we can ask for various investigations like X-ray, MRI, CT scan. But as the advancement, all these bony stress reaction can be easily detected by the MRI. It generally doesn't appear on the plain X-ray film. Its clear cut will be seen on the MRIs. And what is the initial management of these stress reactions? It's first of all, reassure your patient that you will be absolutely normal, and you will be able to do your routine activities, and will be back on the sports arena after recovery of these injuries. So reassurance part is very much required for the athletes. Then the activity modifications, and identify that modifiable risk factors with the help of biomechanics, gait lab, or recording compared to video records of that athletes, and assessment. There are various softwares are available on net which is absolutely free, and you have to put your video on that, and these videos will be assessed by that AI guided software, and they will tell you which part you have to which activity or which body part you have to do strengthening. So these initial management is activity modifications. Like if a runner comes to you and he's complaining of a stress reaction, you can ask him to do cycling, you can ask him to do swimming to maintain his VO2 max or aerobic capacity. And simultaneously, if the lower limb is affected, you can ask him to do upper body activities. So these are the activity modifications. Then return to activity or run, it start with the beginning and progressing initial running. With the you have to once there is a pain-free range of motion, pain-free daily activities of life, then you ask him to do is walking for a longer duration as per his capacities. Like if a person who recovered after initial management of rise and price protocol, say after 2 weeks, then you ask him and he's pain free in his daily activity of routine daily activity, then you ask him to walk on a normal speed for say 10-15 minutes or 30 minutes, and this duration is pain free. Then you can consecutive 2 or 3 days, then you ask him to increase the intensity, that is his walking speed. Then if he is consecutively pain free, then you ask him for next 7 days 7 minutes of or 9 minute 8 minutes of walking, or 9 minutes of walking and 1 minute of slight jog. So you can ask him to do 3 episodes of this. So you have to modify his activity so his bone remodeling will be properly occur, and he can be start doing his sports activity. While you are doing this, if you found his biomechanical assessment, or there is some fault in his running technique, then you can ask him to do change in running technique. When you change some running technique, so that different running technique might give some different sort of overuse of that muscles. So you have to be very careful when you are changing one technique to other techniques. That technique might be relieving you from this injury, but that should not be occurred that technique give you a different injury. So when you give advice to change some training activity, you should be very careful that change in technique is not giving him a different set of injury. And in the last, you have to design your running program in such a manner that the consecutive pain-free running should be there for at least 3 days to 5 weeks, 3 days to 5 days. So, and then you use the per week 10% increment in your running mileage or running speed. So these things you have to keep in mind. Now we are going to study the rehabilitation principles. When you are doing your rehabilitation, or as you are a coach, or you are planning rehabilitation, though it's a specialized portion, it should be under proper guidance with the help of doctor and physiotherapist, and that should be, this course is just to enlighten you. So if one of your athlete or you yourself is suffering, so you take appropriate steps, or basically don't do those things which commonly injured or a layman is doing. So the rehabilitation of any injury depends on the type and site of injury. That is, for fracture it is different, for tendinopathy it is different, for ACL tear, complete tear it is different, partial tear it is different, or if stress reactions, that rehabilitation is totally different. Like rehabilitation for MTSS person is different, or ACL injury patient rehabilitation will be different. So you should be very careful when you can't take or you can't treat with the single method to all injuries. So be very careful when you are planning some sort of rehabilitation. So this is just a guide how it progress rehabilitation, so your athlete or you yourself should be aware. So early mobilization, the basic part is early mobilization, provide a protective splint or brace, and then the range of motion exercises, that is initially free of pain, passive range of motion exercises, and once there is free range, pain-free range of motion, then we have to shift from passive to active. Passive means somebody is doing the range of motion for your joint, and when you yourself is doing that range, like flexion and extension at knee, that is active. And when one of your brother or your sister is moving your leg and your muscles are not getting involved, then it is called a passive range of motion. And when you achieve your full range of motion passively without pain, then we start doing active range of motion exercises with resistance or without resistance. Without resistance in the beginning and with resistance as the conditions allow. So now friends, thank you very much. Rest we will study in the next lecture.